castle crumbled overnight. I brought a knife to a gunfight. They took the crown, but it's alright. All the liars are calling me one. Nobody's heard from me for months. I'm doing better than I ever was. 'Cause my baby's fit like a daydream, walking with his...
Hello, I'm Maddie, and today we're going to discuss a rather common medication prescription I'm sure you're all pretty familiar with. And if you are a female, you're probably on it. That's right, we are going to discuss birth control. But unlike your typical sales pitch of how great hormonal contraceptives are, we are going to focus on the negative side effects of birth control. Now, I will start off by saying that there are many wonderful reasons for being on birth control, with the main one obviously being that it prevents pregnancy without you having to abstain from sex. But it can also be used to cure acne, regulate and lighten your period, alleviate menstrual headaches and pain, ease endometriosis, and even reduce your risk of some cancers, like cervical and ovarian cancer. From these benefits alone, birth control seems to be the biggest medical breakthrough for female health. But if you are like me and have experienced the darker sides of the various birth control options, you may have a quite different opinion on this medical intervention. Now, I know it's normal to experience mild side effects from any medication, especially as your body adjusts to it. But some of the greater side effects that go beyond nausea, mood swings, raging headaches, hormonal acne flare-ups, breakthrough bleeding, weight gain, etc., seem to never subside within some women, resulting in them having to continually shop around for the right form of birth control or stop birth control altogether. And among the more life-altering reported side effects, one in particular seems ever to be often questioned or discredited by the medical field, as even being linked to hormonal contraceptive use. That side effect is the report of psychological changes, specifically depression. But if experiencing depression is among the most common experienced side effects from hormonal contraceptives, why is there so much controversy of the link between the two? Well, for my own interest in this question, I did some extensive research. And well, there wasn't much. And this is the exact answer to why there is such a debate on if hormonal contraceptives are actually linked to psychological changes within female users. It is because there's not much evidence to support if it does. So that is where our talk leads us to today, to answer whether hormonal contraceptives are linked to changes within the mental health of some of its users. And because both physical and psychological well-being is important to the overall health of women. Answering this question will empower women to be more educated and in control of both their reproductive and mental health. To explore this controversial connection, we're going to look at a Danish study as our basis to uncovering the truth behind the connection between hormonal contraceptives and reports of depression. But before we get into the specifics of this study, I want to provide you all with some of the background information that led these researchers to actually explore this topic. You see, research has confirmed that natural hormones found in the female body, like progesterone and estrogen, temporarily alter the neurological makeup of the brain during the different phases of a woman's natural cycle. So, with that information established, it has led many researchers to question how or even whether the synthetic hormones and hormonal contraceptives have the same ability, but on a more consistent basis. And interestingly enough, by looking at other research studies, there is evidence to support that hormonal contraceptives do in fact have the ability to alter certain parts of the brain, specifically on the areas of the brain that control mood and emotion, like the amygdala, insula, and cingulate cortex.
Now, if you are not familiar with these different brain parts, the amygdala and insula play a crucial role into an individual's emotional responses. When there is an imbalance specifically within the amygdala, different neurological disorders can arise. These include PTSD, anxiety, phobia disorders, and that's right, depression. One specific study I found focused on how hormonal contraceptives may alter these parts of the brain. The results showed that there was an increased amount of blood oxygen within the right amygdala when looking at an fMRI brain scan. The right amygdala specifically controls negative moods, and this can help explain why more women on hormonal contraceptives reported being more depressed than those compared to the non-user group. And although the study did not focus specifically on the behavioral changes that came from taking birth control, it provides neurological evidence to help support the belief that hormonal contraceptives can cause depressive symptoms to occur within some users. Now, let's go back to the other brain structure I mentioned earlier, the cingulate cortex. This structure specifically controls mood formation and processing, learning, and memory. From another study I found, the researchers observed the effects hormonal contraceptives may have had on the cortical thickness of the cingulate cortex. And the results from this study showed that hormonal contraceptive users had a decrease of cortical thickness in this area compared to that of non-users. Cortical thickness is connected to human intelligence and is important to the normal ability to regulate mood. This study gives researchers a look into why depression may arise within some hormonal contraceptive users and how changes in the cortical thickness within the limbic system would potentially decrease an individual's ability to regulate her emotions.
And although these studies could not conclude whether the changes that occurred resulted in distinctive mood changes within the subjects on hormonal contraceptives, it provides substantial evidence to hypothesize that hormonal contraceptives do in fact are linked to causing a rise in depressive and other mental health behaviors to occur in women who are on birth control. Now, the study we are discussing does not focus on the brain structures that are altered by hormonal contraceptives, but actually measuring the behavioral changes women experience after being on birth control for a continuous period of time. This is the piece of inadequate research that needs to be focused on more by other researchers in order to strengthen evidence to prove or disprove that hormonal contraceptives can influence changes within individuals' health. So, the objective of the Danish study was, word for word, to investigate whether the use of hormonal contraception is positively associated with subsequent use of antidepressants and a diagnosis of depression at a psychiatric hospital. The depressive variables used to measure if a woman experienced depressive behaviors during her time on birth control was whether or not she was prescribed antidepressants or diagnosed with depression at a psychiatric hospital for the first time during the duration of her contraceptive use. The actual design of the study consisted of observing all adolescent and adult women from the ages of 15 to 34 who lived in Denmark from the years January 31st, 1995 to December 31st, 2013, in order to capture how many users experienced depressive behaviors during their own duration and forms of hormonal contraceptive use. To remove confounding variables that may alter the results, the participants who were observed must have had no prior depressive or mental health issues before their first time being on some form of hormonal contraceptive. After 2 years of analysis from 2015 to 2016, the researchers measured their results by comparing the rate of depression reports from hormonal contraceptive users to that of non-users. And the results showed that all studied birth control forms, like the patch, the combination pill, the implant, and others, showed a significantly positive increase of depression reports in women who were taking hormonal contraceptives. The results also concluded that younger women on hormonal contraceptives had a higher depressive rate than older women on hormonal contraceptives. And even birth control options that only contain progesterone also had an increased rate of depression among its users. The importance of these results helps give both users and doctors a better picture in which or even whether an individual should go on a form of hormonal contraceptive. Increased rates of depression among younger users could possibly be explained by their brains not being fully developed, so adolescent emotions and behavior may be more susceptible to the emotional changes birth control can cause within the neural development of the brain. This might help give guidelines to determine at what age it is more appropriate for women to go on birth control. Identifying which specific type of hormones increase the rate at which depression was experienced gives critical information that estrogen-containing birth control options may be best for women who have a history of mental health issues. Although more research needs to be done to confirm these results, the claim women experience negative mental health changes is a plausible side effect of birth control that needs to be given more attention and recognition by the medical and pharmaceutical world. Birth control is a medical tool that has empowered women to be more in control of their bodies. Yet in some, it is causing disturbances and a decline in their mental health. As a female myself, I feel most empowered when all of me is happy and healthy, including my mental state. I believe we owe it to ourselves to challenge the medical field to care not just the physical aspects of our health, but the emotional and mental components as well.
It is important to state that birth control is not a bad medical intervention, but the biased opinions that overpower the negative side effects forget that medication is not a one-size-fits-all category. The research I have presented today helps shed light on the more negative areas of hormonal contraceptives and even the overall medical field. The Danish study provides some much-needed information for why some women have experienced depressive mood changes seamlessly overnight. It is ever so common to be diagnosed with depression without an explanation by your doctor and be prescribed some type of antidepressant to treat your symptoms. This strategy does not cure depression, but just covers it up with more pills to make our symptoms more tolerable. Why would anyone want to live with tolerable symptoms when the cure to their depression may be as simple as switching or going off of hormonal contraceptives altogether?
So with that, I leave you with a challenge. Before your doctor pushes a new medication, ask questions. Be informed on how it can affect all areas of your health, because only you can know what is best for you. Birth control is a great medical intervention to prevent pregnancy and aid many physical ailments that come with being a female. But do these benefits outweigh the negative side effects that can drastically decrease the overall well-being of some users? Only you can make that decision. But take it for someone who's been on the dark side of the birth control journey. I am much happier and healthier without using synthetic hormones.
Thank you for tuning in to today's talk on The Low Show. Next up, acknowledgements for today's research.
So call it what you want, yeah, call it what you want to. My babies fly like a jet stream high above the